Hey everyone, welcome back to the Pharmacology Vault. Today's video is a must-watch if you're trying to understand adrenergic drugs, the ones that work with your body's fight or flight system. Whether it's treating asthma, heart failure, shock, or even ADHD, these drugs are everywhere. So let's break it down step by step. These are medications that interact with the adrenergic receptors. Those are the special targets in your body for chemicals like epinephrine, norepinephrine, and dopamine. These natural chemicals are called catecholamines, and they are released when your body is under stress, helping you fight, flee, or focus. Adrenergic drugs either mimic these chemicals, activating the same receptors. These are called sympathomimetics. Block their effects. These are known as sympatholytics. These drugs target the sympathetic nervous system, which influences vital functions like heart rate, breathing, blood pressure, pupil size, digestive activity. They act on adrenergic receptors, which are of two main types: alpha receptors, alpha 1 and alpha 2, mainly involved in vasoconstriction, narrowing of blood vessels, pupil dilation, and inhibiting neurotransmitter release. Beta receptors, beta 1, beta 2, beta 3, beta 1, found in the heart, increases heart rate and contractility. Beta 2, found in the lungs and smooth muscles, causes bronchodilation and relaxation of uterine muscles. Beta 3, mainly found in fat tissues, involved in lipolysis. Adrenergic drugs are broadly classified based on their mechanism of action. Adrenergic agonists. These activate adrenergic receptors, increasing sympathetic activity. Adrenergic antagonists. These block adrenergic receptors, decreasing sympathetic activity. In this video, we'll focus on adrenergic agonists, aka sympathomimetics, and learn how they're categorized based on their therapeutic use. Pressor agents, drugs that raise blood pressure. These drugs are life-saving in emergency settings like shock or severe hypotension. They work mainly by stimulating alpha-1 receptors, causing vasoconstriction, which increases blood pressure. Examples: noradrenaline, norepinephrine, the gold standard for shock. Strong alpha-1 action, powerful vasoconstriction with minimal beta activity. Ephedrine, mixed-action drug, increases norepinephrine release and stimulates alpha and beta receptors. Used in spinal anesthesia-induced hypotension. Dopamine, dose-dependent effects. Low dose, renal vasodilation, via D1 receptors, moderate dose. Beta 1 stimulation, up-pointing arrow heart contractility, high dose. Alpha 1 stimulation, up-pointing arrow BP, phenylephrine, pure alpha 1 agonist. Used in hypotension, and also in nasal decongestants and eye drops. Methoxamine, selective alpha 1 agonist, rarely used now but was effective in hypotension. Mefentermine, indirect sympathomimetic, raises BP and cardiac output, used for hypotension in spinal anesthesia. Cardiac stimulants, drugs that boost the heart. These drugs stimulate beta 1 receptors in the heart, increasing heart rate and myocardial contractility. They're vital in treating cardiac arrest, heart block, or congestive heart failure. Examples: adrenaline, epinephrine, a non-selective agonist, acts on alpha and beta receptors. Increases heart rate, force, and vasoconstriction. First line for anaphylaxis and cardiac arrest. Isoprenaline, isoproterenol, selective for beta 1 and beta 2. Increases heart rate and dilates bronchi. Used in heart block and sometimes bronchospasm. Dobutamine, selective beta 1 agonist. Strong inotropic effect, up-pointing arrow contractility, without much effect on heart rate. Ideal in acute heart failure or cardiogenic shock. Bronchodilators, drugs that relax the airways. These drugs target beta 2 receptors in the bronchial smooth muscle, causing bronchodilation. Essential in managing asthma and COPD. Examples: isoprenaline, though non-selective, it relaxes bronchial muscles via beta 2 and stimulates the heart via beta 1. Salbutamol, albuterol, fast-acting beta 2 agonist, great for acute asthma relief. Terbutaline, similar to salbutamol, rapid bronchodilation. Salmeterol, long-acting beta 2 agonist, LABA, used for maintenance therapy in asthma, COPD. Formoterol, long-acting but with faster onset than salmeterol. Bambuterol, a prodrug of terbutaline, longer duration, taken orally for chronic control. Nasal decongestants, drugs for a clear nose. These drugs work by vasoconstricting nasal blood vessels via alpha receptors. This reduces swelling and opens up nasal passages. Examples: xylometazoline and oxymetazoline, potent topical decongestants. Fast-acting and long-lasting. Nefazoline, used for both nasal and ocular congestion, red eyes. Phenylephrine, also works as a decongestant and in eye drops. Pseudoephedrine, oral decongestant, less potent than topical agents but has longer action and fewer rebound effects. CNS stimulants, boosters for the brain. These drugs cross the blood-brain barrier and increase the release of norepinephrine and dopamine in the brain. Used in ADHD, narcolepsy, and sometimes for performance enhancement. Examples: amphetamine and dextroamphetamine, increase monoamine release in CNS. Improves attention and alertness. Methamphetamine, strong CNS stimulant. Higher abuse potential. Methylphenidate, commonly known as Ritalin, used extensively in ADHD and narcolepsy. It has a safer profile than amphetamines. Anorectics, appetite suppressants. These drugs reduce appetite by increasing norepinephrine, and sometimes serotonin, activity in the hypothalamus. Note: some of these have been banned due to cardiovascular risks. Examples: amphetamine, appetite suppressant effect was one of its earliest uses. Phenylphramine, worked via serotonin release, withdrawn due to risk of heart valve disease. Salbutamol, inhibited reuptake of serotonin and norepinephrine, withdrawn due to cardiovascular complications. Uterine relaxants, tocolytics, delay labor. These beta-2 agonists are used to relax uterine muscles and delay preterm labor. Examples: Ritodrine, selective beta-2 agonist, used intravenously in hospitals to delay contractions. Isoxaprine, less selective, used in some obstetric and gynecological conditions. Salbutamol and terbutaline, though primarily bronchodilators, also effective tocolytics due to their beta-2 action on uterine smooth muscle. Let's decode where these drugs act and why they're used. Let's start with emergencies, like shock or severe hypotension. In these situations, we need pressor agents, drugs that raise blood pressure by stimulating alpha-1 receptors and causing vasoconstriction. The key drugs used are noradrenaline, the go-to in septic shock; dopamine, great for cardiogenic shock and renal perfusion; phenylephrine, often used in anesthesia-related hypotension; and ephedrine, especially in spinal anesthesia. These are life-saving in critical care. Next up, heart emergencies. In cardiac arrest or heart failure, we use beta-1 agonists to stimulate the heart. Commonly used drugs include adrenaline, the first-line drug in cardiac arrest and anaphylaxis; isoprenaline, helpful in heart blocks to increase heart rate; dobutamine, a strong inotrope, used in acute congestive heart failure. These drugs help get the heart pumping again when it matters most. For people with asthma or COPD, adrenergic drugs act as bronchodilators. They relax bronchial muscles through beta-2 receptor stimulation. Common inhaled agents are salbutamol and terbutaline, fast-acting, used during acute attacks; salmeterol, formoterol, and bambuterol, long-acting for maintenance therapy. These make breathing easier and more efficient. Blocked nose? Adrenergic drugs come to the rescue again, this time as nasal decongestants. They cause local vasoconstriction in the nasal mucosa. Drugs like xylometazoline, oxymetazoline, phenylephrine, and pseudoephedrine clear the nose and restore easy breathing. But remember, don't use them for more than a few days, or you risk rebound congestion. Let's move to the central nervous system. In ADHD and narcolepsy, adrenergic drugs help by boosting norepinephrine and dopamine levels, improving focus and alertness. Key players here are amphetamine and methylphenidate. These are first-line treatments for ADHD and also used to treat excessive daytime sleepiness in narcolepsy. Some adrenergic agents were once used as anorectics, appetite suppressants. They reduce hunger by acting on the hypothalamus. These include amphetamine, sibutramine, now banned in many countries, and phenylphramine, which was withdrawn due to cardiac side effects. Because of serious risks, their use is highly limited or prohibited today. In obstetrics, we use beta-2 agonists to relax the uterus and delay premature labor. The drugs used are ritodrine, isoxaprine, terbutaline, and salbutamol. These are called tocolytics, and they give time for lung maturation in the fetus or preparation for delivery. For eye exams, we sometimes need pupil dilation without affecting vision focus. Phenylephrine is a short-acting alpha-1 agonist that causes mydriasis, perfect for diagnostic procedures without causing cycloplegia. And finally, anaphylaxis, a severe allergic reaction. Here, adrenaline is the drug of choice. It stimulates alpha-1 receptors to raise BP, activates beta-1 for cardiac support, and opens airways via beta-2 stimulation. Given intramuscularly, it acts within minutes and can be life-saving. To sum it up, adrenergic drugs either activate or block the sympathetic system, and they play crucial roles in treating everything from asthma to cardiac arrest. If you liked the video, make sure to like, subscribe, and hit the bell icon so you never miss a dose of pharmacology wisdom. Drop your doubts or questions in the comments, we love hearing from you. Until next time, this is the Pharmacology Vault, unlocking the power of medicine, one concept at a time.